prepare them to be a nurse. I guess you never know what's going to happen. So you never want to assume. I had a patient who was 32 years old and was there for something very benign and was planning to be discharged. 32 years old. His biggest deal was he was overweight and diabetic. I don't want to say we like ignored him, but we didn't pay as much attention to him as we would anybody else. He was supposed to wear CPAP before he went to bed. He fell asleep without his CPAP because we were supposed to call respiratory. We work night shift. We call them when it's closer to bedtime. Most people don't go to sleep like, 9, 10 o'clock. It's usually later. And I remember I had just gone through, looked at him, said hi to him, no big deal. Next thing I know, somebody's screaming. He had fell asleep. His sleep apnea had killed him in his sleep. 32 years old, just
God.
boom, just like that. Like, so one of the things that unfortunately nursing does is it makes you, you have to think what's the worst that can happen in every
Yes.
situation, unfortunately. And that
Mhm.
is, it's going to flow over into your regular life. And you're going to
Isn't that the
think
truth?
semi negatively about every situation. What's the worst that can happen? So be prepared for anything. You never, even if you think this is a healthy fella, nothing's going to happen. You never know. Just, yeah, I guess
That's
that's,
so true. I like, and you talk about the like it spills over into your real life. Like
Mhm.
yeah,
that is like can I tell you as a ER nurse and coming off of being in the ER for so long, I couldn't believe the cortisol dump that I had and like adrenaline dump that I had coming off of it. Like even a month after, like you just see everything. Like you can catastrophize everything because like with your
Mhm.
kids you're like don't jump on a trampoline because I've seen horrible tib fib fracture or head injury or don't ride your bicycle because like normal things that kids do, like kids do dangerous things carefully a lot. Like it's part of being a kid. It's like a developmental stage is to do dangerous things but to be careful at them so that they don't get hurt, and you want them to do that, but like man, it is I've had such bad adrenaline dump afterwards because you see like the craziest worst of the worst, and you don't want to make your kids like fearful to do anything. Like you want them to still be
Mhm.
kids. So
yeah,
but
yep,
being a nurse is hard. I mean it messes with your brain sometimes.
yeah. My wife is like, I'm not a negative thinker. I'm a realistic thinker,
Realistic.
right? Like
Yeah.
it could have, that you,
These
you got to
things
be
happen to
careful.
real people. Yeah, I will never forget the first time that I had a little kid who fell out of a second story window. Like we have a two-story house. I get anxiety. I would get anxiety when my kids are little about them being upstairs. Like